Hello everyone. Today we are gonna talk about developmental dysplasia of the hip, also known as congenital hip dislocation. This condition comprises a spectrum of disorders including acetabular hip dysplasia, subluxation, and dislocation. Malarticulation, leading to dislocations, is also included in this condition. Dysplasia is an abnormal growth or development of tissue. So, acetabular dysplasia means that the acetabulum, or the socket that holds the head of femur bone, is developed abnormally. A subluxation means partial or incomplete dislocation. So, developmental dysplasia of the hip means that the hip joint is developed abnormally so that there is dislocation at the hip joint, presenting since birth. And in this condition, there is abnormal development of the acetabulum and it is shallow, leading to instability of the hip joint. Since developmental dysplasia of the hip is usually present since birth, it is normally identified during newborn screening. If somehow, congenital hip dislocation is missed during newborn screening, there's a high chance of the child may be presented in later life, with severe outcomes, such as pain and limping. So, it is vital to assess for congenital hip dislocation during the newborn examination, and therefore, positive findings should not be missed. Causes of congenital hip dislocation can be due to genetic factors, hormonal factors, intrauterine malposition, and postnatal factors. Genetic factors play a main role, as this condition tends to run in families. High levels of maternal estrogen, progesterone, and relaxin in the last few weeks of pregnancy may aggravate the condition in infants. Intrauterine malposition, especially in a breech position with extended legs, favors dislocation. Postnatal factors may contribute to the persistence of neonatal instability and acetabular maldevelopment. And now, let's move on to the clinical features of congenital hip dislocation. These are asymmetry of hip joints, clicking sounds with hip movements, asymmetry of skin creases at the hip, shortening of the affected leg, also known as the Galeazzi's sign. There will be limited abduction of the affected hip joint. The hip is usually internally rotated and the child may not be able to walk properly. Also, there are two tests that are being done in the clinical setting due to suspicion of congenital hip dislocation. The first test is Barlows test. This test becomes positive in congenital hip dislocation. The second test is Ortolani's test, and it also becomes positive. Now, let's talk a bit more about Barlows test. In this test, what we do is check for dislocation of the hip joint by flexing and adducting the hip, while applying a slight posterior force. If developmental dysplasia of the hip is present, the hip will be dislocated, and the test becomes positive. And now, let's talk about Ortolani's test. In this test, we check for relocation of the already displaced hip joint, by flexing and abducting the hip. If developmental dysplasia of the hip is presented, the hip will be relocated, again the test becomes positive. During the management of congenital hip dislocation, we are focusing on the closed reduction of the hip joint. If closed reduction fails, the next step is to apply traction. Applying traction means the affected leg is pulled using a weight. Splinting is done to immobilize the joint, and keep the joint in position. Splinting is kept from 6 weeks to 6 months depending on the requirement. If all the above methods were unsuccessful, then the next option is to go for the surgery. The splinting methods that are available are applying a hip spica and applying abduction splints such as Van Rosen's splint and Pavlik harness. Hip spica is a plaster of Paris cast, applied after positioning the hip at 60 degrees of flexion, 40 degrees of abduction, and 20 degrees of internal rotation. Van Rosen's splint is an H-shaped malleable splint, and it easy to apply. Pavlik harness is more difficult to apply, but gives the child more freedom while still maintain its position. Common complications of congenital hip dislocation are failed reduction of the hip joint, avascular necrosis of the head of the femur, deformity, and development of abnormal gait.
Hope you enjoyed the video and don't forget to like, comment and subscribe.